Is scalp micropigmentation different from a regular tattoo? Have you ever wondered if scalp micropigmentation is the same as a regular tattoo? The answer is a resounding no. Scalp micropigmentation, often referred to as SMP, is a specialized cosmetic procedure aimed at mimicking the look of natural hair follicles on the scalp. This technique is particularly beneficial for those experiencing hair loss or thinning hair. In contrast, regular tattoos are primarily decorative and do not aim to replicate hair or serve a restorative purpose. One of the main differences lies in the equipment used. SMP employs ultrafine specialized microneedles that are significantly smaller than those used in traditional tattooing. These tiny needles allow for precise pigment placement, closely resembling individual hair follicles. On the other hand, traditional tattoos utilize larger needles designed for broader applications, which cannot achieve the fine detail needed for hair simulation. Another key difference is in the ink itself. The inks used in scalp micropigmentation are specially formulated to be hypoallergenic and non-toxic, ensuring they blend seamlessly with the scalp and existing hair color. In contrast, traditional tattoo inks have different chemical compositions that may fade unevenly or alter in color over time, which is not ideal for scalp applications. The techniques employed in both procedures also differ significantly. SMP uses a dotting or pointillism technique, where tiny dots of pigment are placed into the upper layers of the scalp skin to create the illusion of hair follicles. Traditional tattooing, however, often involves scraping or shading techniques that result in larger pigment deposits and less precision. When it comes to pain and recovery, SMP tends to be less painful due to its less invasive nature and finer needles. Recovery time is also shorter, with fewer side effects. In contrast, traditional tattoos may requiring longer healing periods and carry a higher risk of complications, such as infections or allergic reactions. Training and specialization are crucial in both fields. Practitioners of scalp micropigmentation undergo specific training focused on scalp anatomy, hair follicle patterns, and the unique techniques necessary for realistic results. Traditional tattoo artists, while skilled, may not have the specialized knowledge required for effective scalp micropigmentation. In terms of longevity, SMP is considered semi-permanent, lasting several years before touch-ups are needed. It provides a natural appearance that closely resembles real hair follicles. Regular tattoos, however, are permanent but can fade or blur over time, often lacking the natural look that SMP achieves. From the perspective of plastic surgery and non-surgical hair restoration, scalp micropigmentation is a refined technique designed to enhance the aesthetic appearance of hair loss with minimal invasiveness. It fundamentally differs from traditional tattooing, which is not tailored for hair simulation and lacks the specialized approach necessary for effective hair restoration. If you are considering either option, it is always best to consult with a qualified professional to determine what is right for you.